Welcome back to The Wellness Effect. Joining me in the studio is Dr. Luci Fatela, who is passionate about emergency medicine and critical care. Welcome, doctor.
Thank you.
When is my medical condition an emergency and when is it not?
So, when you have anything that unexpectedly changes, a sudden change in your current illness or in your general situation, so shortness of breath, not being able to talk, not being able to walk, whereas previously you were, not being able to see, having severe stomach pain that no amount of painkillers you've taken helps, having severe chest pain, if you've been stabbed, if you fall and your leg is facing the opposite way, those are things that you need to come in for, because that is a medical emergency. So anything that suddenly, unexpectedly happens.
And where do you go when you need to go to the hospital?
I think that's a really good question, because a lot of the public don't know that there's different various levels of healthcare. So firstly, we talk about a drainage area. So each hospital or clinic has a drainage area. It's a circumscribed area that has been demarcated to service that area, that one hospital. So generally you'll find that, especially in state, if you go to a hospital and you're not from the area and you're not a life-threatening emergency, you will be sent away because of the fact that you are not part of the drainage area. This is to try and help us decrease the load of patient volume so that we can actually attend to patients and give beds out. The other issue is that a lot of people don't know that you don't just go to any random hospital. So you need to actually see where you need to go in terms of your illness. So if you've had something for a while, like a flu, a stomach bug, and you need to get attended to, like you would go to a GP privately, here you go to a local clinic. Clinics are run by nurses. Sometimes there'll be doctors. Sometimes the doctors only come once a week. Whichever that local clinic of yours structure is, that's how they will run it. If they feel that they cannot handle the situation, they will up-refer you to a district hospital or a regional hospital. These hospitals are hospitals that have doctors, they have theaters, they can do the basic things, but they don't really have specialists. Regional will have some specialists, but not super specialities. So when I talk about super specialities, I'm talking about cardiology, vascular surgeons, neurosurgeons, so things that require a little bit more studying, a little bit more speciality. Then after that, if they can't handle it either, or they feel that you need further investigations or further management, they will up-refer you then to a central or tertiary hospital. So like in Pretoria, Steve Biko Academic, Charlotte Maxeke in Joburg, things like that. Those are your central hospitals. Those are ones that super specialize, have the ability to do certain investigations like MRI, CT scans, just being able to do a lot more. So you can't just go to a central hospital and be like, I'm here for my flu. You need to kind of work up the ranks. You need to go to the appropriate place, because if you do come to a central hospital, the chances of you being sent away because you're not a life-threatening emergency. I'm saying this, though, in that if you do have a life-threatening emergency, you should go to any hospital that is closest to you so that you can be stabilized and then move to the appropriate level of care.
And what would constitute as a life-threatening emergency?
So as I mentioned, so it's things like you all of a sudden cannot breathe, you can't speak, so like having a stroke, you can't see, sudden visual loss, you've been stabbed, you've been in a car accident, all of those kinds of things. You need to then go to whichever hospital is closest to you to rather be stabilized and seen to, and then you can be referred to the appropriate level if needed.
And how do emergency rooms work? How do they kind of rate, the level and severity of your emergency when you arrive?
To a certain degree, every hospital is slightly different, but all through South Africa, we follow the South African triage scale, so the SATs. So this is a scoring system that we place to triage patients to see whether or not you need to be seen to immediately or if you're in the right place. So here we look at your vitals, so things like blood pressure, your respiratory rate, your heart rate, whether or not you're awake or alert. And this is usually done by a nurse or a clinical associate. In some places, doctors even do it. So it depends on the hospital's planning or systems who actually will perform the triage. From there, you're going to be assigned, so each vital in the scoring system has a number to it. So you actually end up by getting a score. There's certain confounders like pregnancy, abdominal pain that up the score. And once you get a score, a number, it's actually a number that's dedicated, you're either going to fall into a green patient, a yellow patient, an orange patient, or a red patient. So this actually demarcates when you're going to be seen. So a
Okay.
green patient is less of a priority. You will be seen within 4 to 6 hours. So that's your more or less waiting time. A yellow patient, you're going to be seen between 1 and 2 hours. An orange patient between 10 and 15 minutes, and a red patient immediately. So our red patients don't tend to get actually triaged. This is something that we see because surprisingly, people will always come in and be like, how's the doctor assessing you? We actually assess you from the moment you walk in. If you're able to walk in and talk to me, I already know you're breathing okay. You have a full level of consciousness, or at least a decent one, to be able to have a discussion with me. So we also take that, the actual clinical picture, and we use that with the SAT score, and then we decide where you're going to fit in, what color you're going to be graded at. Which also then makes me want to say that if a person comes in, it's not like a queue at a bank teller. It's not a first come, first serve. So yes, once you get triaged, you will be triaged in the manner that you came into the hospital. But once you have that triaging scoring system attached to you with your vitals, you're going to then fall into those color categories. Greens will be seen last because of the fact that you are not as an emergency as a yellow, or as an orange, or as a red. So patients sometimes get very upset because they're like, I was next. But actual fact, we're actually going according to that SAT score, according to the vitals. Once we actually have seen everyone in that same color category, then certain confounders like elderly, pediatric patients, so babies, and pregnancy, those patients will be seen to first in those color categories.
No, I think it's really essential that you're saying this, because I have been in the emergency room and have seen people go past us, and I'm like, what's going on? But now I understand. Is there a role that hospitals can play in almost, putting a chart for us to know? Is it at the directive of the doctor in charge in the emergency room?
So there should actually be notices around. There should actually be, so like in some hospitals, like the hospital I work at, there is a big notice on the door of the triage where the doctor's sitting. And it tells you if you are a green patient, you will be waiting 4 to 6 hours. And if you are a yellow patient, 1 to 2, and so on and so forth. It also is, I think, important that the triage nurse or the triage clinical associate, whoever's doing the actual first triage, that first point of care, actually tells the patients, this is how it's going to work, you're going to wait, because it is frustrating to sit there and see everybody coming past you. But in the same breath, you should actually be happier, because it means that you are not as ill as those people. And those people are then probably more life-threatening conditions than what you are sitting and waiting.
How best prepared can they be? So let's say there's an emergency. You've talked about like hospital, clinic, etc. What should they do in that level of emergency? Is it to call 911 or 10 111, I think?
So I think in an emergency, it's best to always call an ambulance. Unfortunately, where we live, they will ask you whether or not you have a medical aid. If you do, then you're going to give the medical aid details, and any of the private ambulances will come. If you don't, they will probably give you a quote on the phone if you accept it. This is naturally everything excluding a car accident, because once a private ambulance stops at a car accident, they are going to take you regardless of whether or not you have medical aid. They will take you to the closest hospital. So if you are at home and you have this medical emergency, you can't breathe, for example, or a family relative is complaining that they have severe chest pain and you're worried about a heart attack, calling the ambulance. However, we are stretched. Our government ambulances have actually decreased in the number of ambulances that are available. So sometimes people do complain that they wait a significantly long time, and it's no fault of, except for the fact of lack of resources. So in that case, if you are able to get yourself to the closest hospital, or you can get your family member to a closest hospital and it's safe to do so, so not like in a car accident where you're worried about them breaking their spine. I'm talking about like chest pain or shortness of breath, to actually climb into the car and drive them to the hospital. But I would still call the ambulance at first.
So, Dr. Fatela, a lot of the time people run to emergency rooms, maybe for the wrong reason. Do you see that a lot?
We do. I think a part of you is always scared when somebody's sick, especially when it's a family member and you don't know what to do. So it is understandable. But then on the other side of being there, then having overwhelming amount of patients, then it is frustrating when patients come to the wrong place. So we do see a lot of it. We also see that patients sometimes call the ambulance for minor things, like they've been sick for 3 weeks and they've just had diarrhea and they're perfectly capable. And then there's the ones that are very sick, gunshot wounds that then the ambulance is unable to pick up because of that. So we do see a lot of patients coming in not knowing where to go. It's understandable that they're a little bit frustrated because they just want healthcare. But like I mentioned, they don't know where to go. They don't know that if you're not acutely ill, if it's not a life-threatening emergency, something that has suddenly, unexpectedly changed, that you should actually start at the level of a local clinic or a district hospital and not just rush to your nearest one. That's only purely in the cases of an actual emergency.
Sure. So I think it's just good for the audience to understand that there's life-threatening, and then there's issues where you could just go to a clinic or schedule an appointment with your doctor for the next day.
If you think your GP can handle it, then you shouldn't be going to an emergency room thinking you are dying.
Remember to subscribe so you don't miss out on any of the episodes. See you next time on The Wellness Effect.
BankMed, the medical scheme of choice for the financial services industry. The Wellness Effect is proudly brought to you by BankMed, yours in good health.